Hi, it's Helen and Karen here. We're here today to talk to you about your baby's newborn screening test, which some of you may refer to as your newborn blood spot test. Now, this test will be offered to your baby between 48 hours and 72 hours of life. So if you're in hospital, that will be offered to you by your neonatal nurse or your midwife. Now, the test itself involves a heel prick on your baby's foot, and it involves collecting blood onto one of these cards. Now, these cards may look different in the country that you're watching this in. So Karen and I are in Brisbane in Australia, and this is what our cards look like. So they're made of a carbon paper, and you'll see that there's 4 circles there that we need to fill with blood. Now, once we've filled this with blood, this goes off to a testing centre and is tested for many rare conditions that newborns may be susceptible to. Now, these conditions that we test don't normally have any symptoms that you would see in your baby, which is why it's really, really important that we do this test. Usually with this test, no news is good news. So I'm going to hand you over to Karen, who is going to talk you through the process and show you exactly how we would do this test on a baby. Now I'm just going to tilt the camera down so that you can see what Karen is doing.
Okay. So depending on whether you are still in hospital and having this test done by a midwife on a postnatal ward, you may be in special care nursery where one of the special care nursery nurses may do this test. You may be in the community and a community nurse may do this test. But in special care nursery, we always generally tend to make sure the baby's swaddled. As in our previous video, we've talked about swaddling being a settling technique. So this helps the baby feel safe and secure. Some midwives on the postnatal ward will do this test while the baby's actually feeding at the breast. And we just need to have one foot exposed. So if the baby's dressed under the wrap, we will just take one foot out, okay? And then at this point, I will wash my hands, and whoever is doing this test will always wear gloves. So wash my hands, all my equipment is ready to go, and I will go through the equipment required shortly. Okay. So we use a little heel lancet, and these come in different sizes. So we've got newborn, and we have the little preemies as well. And what we'll do, we'll remove that, and then we will just grab your baby's foot and we will prick at the side of the heel, and you'll hear like a clicking noise. All right, so that will pierce the baby's heel, and then we do some very gentle squeezing, and we will let the droplets of blood just drip into the circles. So each circle on the card might require 3 or 4 drops of blood. Okay. All right. This can take varying amounts of time to complete. It all depends on how well your baby bleeds. All right, so that's done. We'll take a little bit of cotton wool, just wipe the foot there, and then we pop our little spot plaster onto the baby's heel. And then that's the test complete. And when it's complete, it will look a little bit like this. See where all the circles on the card are full of blood. And then that is sent away to the neonatal screening testing lab. And the results will be readily available at different times. So depending on what disorder they're testing for, they take varying amounts of time to get results. And as Helen said, no news is good news. Okay, and that concludes our demonstration on the neonatal newborn screening test. And if you are enjoying our videos, please like and subscribe so that you will know when we have new releases out on YouTube. Thank you.